Well, just as we were trying to deal with Delta, we are now seeing a Gamma variant start to emerge. This was first identified in November of 2020 in Brazil. It's now spread to a few dozen countries. The US does have the Gamma variant. There are a few cases in Oklahoma as of yesterday. We know of 19 cases of the Gamma in Oklahoma. It is a variant of concern by the CDC. One of the things is that there is the difference in the genetics for the Gamma variant is there are shifting of the spike protein on the surface of the cell. A spike protein, in review, is the protein portion that is on the coding surface of a virus that attaches to a cell to infect. A vaccine is generally, a lot of times a vaccine can be made to these proteins, to a protein on the outside of the cell. So you can effectively think of an antibody that we've mounted immunity to coat the outside of these proteins so that it cannot attach to a human cell and and infect the cell. You might see a virus in the bloodstream, but it cannot infect a cell and replicate and therefore spread. So we do now have a possibility that the current vaccines that we have may not be good enough to recognize the spike protein on the Gamma variant. It is very early. So it's not necessarily gloom and doom. Of course, science, like everything else in medicine, takes a little bit of hindsight, continuing to research this and see really what those numbers are going to be with our vaccines that we have. That also makes it more infectious, so it is going to be more easily to spread. Probably more easy than the Delta variant. Again, still looking at those numbers. We are watching very closely to see if we're going to have a surge of a Gamma variant that may come under the radar for not just the vaccines that we have for prevention, but the monoclonal antibodies that we use for treatment. So more to come, again, very, very early, but more to come as we go forward in the next 2 to 6 weeks.